All right, today we're jumping into a really fascinating medical condition called immune thrombocytopenia, or ITP for short. And it's a perfect example of how one disease can tell two completely different stories, all depending on a patient's age. It really shows you just how complex, and sometimes how confused, our own bodies can get.
So let me just start with a question for you. What if I told you there's a bleeding disorder out there that acts like two totally separate diseases, and the only thing that separates them is how old the patient is?
Well, that's the strange reality of ITP. For a kid, it's often this sudden, dramatic thing that, thankfully, is usually over pretty quick. But for an adult, it can turn into a chronic, lifelong saga that has to be managed year after year. So what on earth is going on?
Okay, to really get what ITP is all about, we first have to understand what happens when our body's own defense system basically turns on itself. It's a classic case of a body betrayed.
So at its heart, ITP is an autoimmune disorder. The simplest way to think about it is like this. Your immune system is your body's security force, right? Well, in ITP, that security force gets its wires crossed and makes a huge mistake. It starts attacking its own first responders, the platelets that are absolutely essential for clotting your blood and stopping you from bleeding.
So how does this friendly fire actually happen? Well, it all starts when certain immune cells, called B cells, go rogue and start making these things called autoantibodies. These antibodies then stick to healthy platelets, basically slapping a destroy me sign on their backs. The spleen, which acts as the body's filter, sees these tagged platelets, thinks they're invaders, and gets rid of them. And now you've got a problem. Your bone marrow senses the platelet shortage and goes into overdrive, trying to pump out more, but it just can't keep up with the rate of destruction.
And this, right here, is where our story splits in two. Because how this whole process plays out is just dramatically different depending on whether we're talking about a child or an adult.
Now, look at this comparison. It's pretty wild. In kids, ITP often hits them like a lightning bolt, usually right after something simple like a cold or a virus. But then, just as suddenly, it often just goes away on its own. For adults, it's the total opposite. The onset is slow, kind of sneaky, doctors call it insidious, and once it's there, it tends to stick around for the long haul, becoming this chronic up and down condition.
The numbers here tell a really interesting story too. The overall rate of ITP is pretty similar between kids and adults. But look at who is getting it. For kids, it's spread throughout childhood. For adults, though, there's a huge spike in people over 70. And here's another twist. In childhood, it affects boys and girls pretty much equally. But in adulthood, women are twice as likely as men to get it, especially between the ages of 30 and 60.
So, let's say your platelet count is dropping. How would you even know? Well, a lot of the time, the very first clues show up right on your skin. Now for adults, about 2/3 of them will notice some kind of bleeding. But get this, a full 1/3 of adults with ITP have zero symptoms. None. They find out they have this serious condition completely by accident, maybe from a routine blood test for something totally unrelated.
The classic signs, though, are these things you see on the skin. You might get petechiae, which are these tiny, pinpoint red or purple dots. They look like a rash, but they're actually tiny little bleeds happening right under the surface. When a bunch of them cluster together, you get what's called purpura, which looks more like a big bruise. On top of that, things like frequent nosebleeds or bleeding gums are also major red flags. And for over half of all kids with ITP, a skin rash like this is literally the only symptom they have.
Okay, so the signs are there. How does a doctor actually confirm that it's ITP? Well, this is where it gets a little tricky, because ITP isn't diagnosed like most diseases. It's what we call a diagnosis of exclusion. This right here is probably the most important thing to understand about how ITP is identified. There's no single magic blood test that lights up and says, hey, you've got ITP. Instead, doctors have to become detectives.
So how does that detective work go down? Well, the first clue is a blood test, showing that only the platelets are low. The red cells and white cells are totally normal. That's a huge hint. From there, it's all about ruling out the other suspects. Could it be an infection? Is it a side effect of a new medication? Could it be something more serious? It's only after they've crossed every other possibility off the list that a doctor can confidently turn and say, yep, this is ITP.
So it probably won't surprise you that just like the disease itself is different, the way we treat ITP in kids versus adults follows two completely different playbooks. And this difference in philosophy is just so important. For children, because we know the condition usually just vanishes on its own, the default strategy is watchful waiting. Basically, doctors keep a close eye on the child, but they try to avoid using powerful drugs unless the bleeding gets serious. For adults, it's a whole different ballgame. Since it's usually chronic, the goal is active management.
using medication to get that platelet count up to a safe level and keep it stable.
For adults, the treatment usually climbs up this ladder. The first line of defense is almost always corticosteroids, to calm down that overactive immune system. If that doesn't do the trick, or if the ITP comes back, doctors move to second-line therapies. These are newer drugs that can do things like tell the bone marrow to ramp up platelet production. And then, for the most stubborn cases that don't respond to anything else, removing the spleen, which remember is the main place platelets are destroyed, can sometimes be a permanent fix.
Which brings us to the end of our story. What's the long-term outlook for our two patients? Well, as you might have guessed, their endings could not be more different. For children, the news is overwhelmingly positive. The vast majority, we're talking more than 70%, make a complete recovery, and they often do it all on their own, within just a few weeks. For them, the story has a happy and usually very quick ending.
But for most adults, the journey is chronic. It becomes a part of their life, something to be managed, with periods where things are good and periods where they relapse. It's not a short chapter, it's a lifelong saga of checkups and ongoing management.
So we end right where we began, with this big question: why? Why does the exact same autoimmune attack lead to a short-term illness in a child, but a lifelong condition in an adult? The answer is probably buried deep in the mysteries of how our immune system develops and changes as we age. It's a puzzle that scientists are still trying to piece together, and it's just a powerful reminder of how much we still have to learn about the human body.